who can get osteoporosis? Is this something that can affect everyone, right? So basically, off the cusp, yes, anyone can get osteoporosis, or anybody can develop osteoporosis, right? This is something that develops, it doesn't just happen overnight. But there are some populations who it is a little more common with. You may or may not be aware of this, but women, particularly postmenopausal women, at a higher risk of developing osteoporosis. And basically, a big part of this is that there are some hormonal changes, specifically estrogen, which affect bone health tremendously. After you go through menopause, your hormones, if they weren't already crazy enough, they get even crazier, and some of the bone health hormones like estrogen actually go down a little bit. So with that happens, it doesn't only affect your mood, it affects your bone health as well, which is why a lot of women are normally dealing with this or notice with this, especially as they get older, postmenopausal. In addition to just women in general, non-Hispanic white and Asians are actually the most increased risk for developing osteoporosis. African American and Hispanic women are at less risk of developing osteoporosis when it comes to a both male and female perspective. But just realize that there is, again, some of that genetic variant that we talked about. So just because you're a woman, you might actually have an even more increased risk of developing osteoporosis if you are of Asian descent or non-Hispanic white descent. But again, these aren't anything we can really control or do about it. It's just something to take note that you might be in one of those populations who would be advantageous to potentially get frequent treatment and to get those checkups much more. In addition to this, we talked about women, but this actually can affect men as well. Especially as someone gets older, you'll notice this theme that the older somebody gets, the higher their chances of getting osteoporosis are. Hormone regulation, specifically hormone regulation in a good way, actually decreases as we get older regardless. And when it comes to testosterone levels, those usually decrease quite a bit as we get older as well. This has a kind of less pronounced effect than the estrogen changes in females, but it is something to note that when males get older, their loss of testosterone will take a very, very tiny effect on overall bone health, and they are still at risk. One of the reasons why men actually don't develop osteoporosis quite as soon as women, females, is because they actually continue to develop their bone mineral density much later in life. So they're kind of offsetting that overall progression down the road, which is obviously a very big lever to pull when you're talking about why am I getting bone mineral density decreasing in my overall body. Again, males, that's just how it is. They develop it later in life. Peak bone mineral density, peak bone mineral density. What is this? It's basically the highest level of bone mineral density that you will develop in your life. This happens with a wide variety of things. There's like peak intellect in our life. There's peak muscle strength. Bone strength is the same thing. And our peak bone mineral density is usually around the 25 to 30 age range. So leading up to that in your childhood, this is actually a prime time for overall bone health development. So if you're watching this and you have either grandkids or even kids and you're like, what kind of sports should they do? They should be doing stuff that's going to be challenging their body. It's going to put load on bones. It's going to potentially even be high impact if they can handle that, because those different things help to improve overall bone strength. And when we're talking about different ways to prevent this going down the road, the bone strength and the bone mineral density you develop as a child can literally lead into the rest of your life. So it's a very, very important thing if you're a parent, if you're a caregiver of somebody who's a child, or even somebody who's still not quite into that 25 to 30 age range. There is still time. There's still time to develop your peak bone mineral density, because Once you hit that point, you're basically kind of going back in time, right? So if somebody has a higher bone mineral density, a peak bone mineral density, I should say, you're giving them more years that their bones are going to be healthier and stronger. Just like somebody who is building a good base level amount of strength, the amount of strength drop off is going to be much less drastic over the years. So it goes the same with bones. Crucial time to develop, and you could still build this later. When I'm saying this, you're probably thinking, oh dear Lord, like if I wasn't physically active when I was a kid, like is all hope is lost? No, you can still develop bone mineral density and actually maintain it and potentially even build it a little bit as you get older. But the peak is what we're talking about here. The peak is built through our early adolescence all the way up into about 25 to 30 age range. Something else that will kind of lead to potentially getting bone mineral density if you're on any certain medications. And again, I don't know too much about the medication. This isn't entirely my scope of practice, but certain cancer medications and glucocorticoid steroids may increase the risk. This is because, again, their interaction with the hormones that happen in our body. And any medication that affects absorption of calcium and vitamin D, or just conflicts with that at all. There are a lot of medications that mess with a lot of different things. They fix one thing and then lead to another thing. And this is the same when it comes to those types of things with vitamin D and calcium. And those two are crucial. We'll talk about those later on different ways we can kind of prevent it. Also, there's something I actually just learned about this. It's called idiopathic juvenile osteoporosis, where basically as a juvenile, you develop it just because, again, the cards you were dealt. It's something genetic. It's sort of rare. It's not really seen very often in common society. I actually just learned about it, as I said. Most recover with absolutely no treatment, as in they don't really do much about it. After they get tested, they just kind of go around their normal lives, try to, I'm assuming, become physically active and eat well, and it just kind of works out on its own. So that is talking about who can get osteoporosis. Anyone can, but certain demographics, specifically females, older females in that non-Hispanic, white, and Asian descent are going to be at the highest risk. So remember that if you do fall into that category.